Good morning, everyone. I'm Dom Gors, and I will be chairing this ML4AU session today on data governance in federated learning. I am the director of the UQ Data Science Collaborative Research Platform and one of the CI on the ARDC Frontier Federated Machine Learning Initiative. So I would like to begin by acknowledging the traditional owners of the lands on which I am speaking to you today, the Turrbal and Yagara people in Brisbane. I also acknowledge the traditional owners of the land on which each of you is joining from. I pay my respect to their elders past and present, and I'd like to acknowledge First Nation colleagues with us today. So the ML4AU community of practice is dedicated to sharing and learning and collaborating on machine learning and AI. And I would like to really thank the ARDC for supporting this community, and in particular, Elena Filippi for coordinating this session. So today, the session will be in the form of a collaboration cafe format. We will begin by a presentation on a review of data governance in federated learning, and then this will be followed by group discussions in breakout rooms. And to do this, I will be we are joined by Lois Holloway, who is the Director of Medical Physics at the Ingham Institute for Applied Medical Research and the lead of the Australian Cancer Data Network. We have Sach Jayasinghe, CEO of QCIF Digital Research. We have Niana Bharati, who is a research data specialist in AI/ML with the ARDC. Rona Duncan, Research Platform Fellow at the UQ Data Science CRP, and Rebekah Eden, Senior Research Fellow at the UQ Business School and Queensland Digital Health Centre. And we will start with a presentation, and Beck is going to give that overview. Over to you, Beck.
Perfect, thanks, Dom. I'll just share my screen, change a few settings. Perfect, thanks so much, Dom. So today I will be presenting the insights from our scoping review on the governance of federated learning in healthcare. This was an interdisciplinary research project, and it spanned academics and practitioners across business, technical, and health domains. So it actually stems from an MRFF funded project that we have going on at the moment, which was really seeking to actually develop federated learning infrastructure to support healthcare improvements. So before I begin, I would also like to echo Dom's sentiments and acknowledge the traditional owners of the various lands on which we meet upon today. So as Dom said, today there will be a paper presentation first. It will take roughly 20 to 25 minutes, followed by a breakout sessions where we actually discuss all of the different governance mechanisms that we've seen in the presentation today. And then we'll come back to the main session to consolidate our insights. So before I get into the nitty-gritty details of the paper, I always like to start with these quotes. And that is that the highest attainable standard of health is a fundamental right of every human being. So we all know that equitable, effective, and efficient access to healthcare is a fundamental human right. But we also know is that current healthcare funding arrangements are simply not sustainable. So effectively, if we keep funding healthcare in the way that we're funding it now, if we keep providing healthcare in the way that we're doing so now, we're not going to be able to deliver on this fundamental human right. And that really motivates a lot of the work in which we do, because our goal is to try to figure out, well, how can we keep delivering upon this fundamental human right? And this concept of the learning health system vision effectively emerged to address this need. Now, the learning health system vision seeks to improve the value of healthcare via rapid learning from data and immediate translation to practice and policy. Now, this overarching vision has become more and more attainable due to advancements in digital health technologies, which have produced a wealth of data to rapidly learn from. But when we think about that, we now have this amass of data, but to actually learn from that data, it has traditionally involved sharing data across institutional barriers, and it also has involved using data for purposes other than it was originally collected. So typically we would go to a healthcare organization as a patient, we would provide them with our healthcare data, we would get treated, and that's sort of where we thought our health data would end. But what we're seeing now is that there's almost like an immortal character to health data, which can be used time and time again for a whole variety of different purposes. This has actually created some difficulties due to privacy and security concerns, as well as ethics and governance challenges. And these concerns largely centered around the sharing of data, as opposed to data staying within the confines of the original collecting organization. So federated learning has fundamentally come about as a potential solution to this data sharing problem. So effectively, federated learning seeks to build AI models on the basis of distributed and local data sets across multiple parties without data collection to prevent data leakage and privacy violations. Effectively, what happens in a federated learning is that each data owner still retains the data at their site. So these are often referred to as site nodes. So every site node keeps control of their own data and doesn't share the data. And then there is the model user, which is also referred to as a central node. And that model user sends the model through to each of the site nodes. The site nodes then sends the learning of the models back to the model user, where aggregation takes place. And this is a highly iterative process and can take multiple rounds. So this is how it is designed to overcome a lot of those data sharing challenges. And it has already been used in practice. So there's been improvements in early cancer diagnosis as a result of federated learning. There's been improvements to a range of different diagnoses as well due to federated learning. And the reason federated learning is such a strong value proposition is that there's so many different sites can all now take place in such a federated learning environment. So we're getting data now from more, or we're learning from more sites than ever before. However, even though data sharing is not involved when it comes to federated learning, some concerns still eventuate. And these concerns surround things like ethical data use, unforeseen workflows emerging, and unintended consequences arise. There's also the possibility for federated learning to introduce new concerns surrounding novel model attacks. This includes things like model stealing, model inversion, and model poisoning, which means that it's really important to have trusted partners involved in that federated learning ecosystem. And effectively, governance is required to manage these challenges. But when it comes to governance, it's quite an amorphous term. Governance can seem to span almost anything in an organization. So the lens that we're using in this particular project is the term data governance, and that examines procedural, relational, and structural mechanisms necessary to govern raw data and how it's captured, stored, shared, analyzed, the algorithms developed, and how its outputs are used. So it's really important here when we talk about data governance, it's not just about that raw data and the collection and storage of raw data, which is how some people commonly think of data governance. Data governance expands the entire life cycle, all the way from its collection, all the way to its usage. So the theory that we use describes procedural, structural, and relational mechanisms. Procedural mechanisms aim to ensure that the data is accurately recorded, held securely, and used effectively and shared appropriately. Common ways of thinking about procedural mechanisms are things like standards, procedures, privacy, contractual agreements, all of those sorts of things we think about when it comes to procedures. Then I'm going to talk about structural mechanisms. Structural mechanisms aim to determine reporting structures, governance bodies, and accountabilities. Effectively, simply put, this is simply the roles and responsibilities of the individuals involved in federated learning, And then there's the relational mechanisms. And the goal of relational mechanisms is to facilitate collaborations between stakeholders. So those structural mechanisms outline a whole range of roles, responsibilities, stakeholders involved, and the relational mechanism aims to develop trust between these stakeholder groups and remove some of the tensions between these stakeholder groups, as normally different stakeholder groups have different values at play and tensions can emerge that need to be resolved. So that led us to the research question of what governance mechanisms can be used to underpin federated learning in healthcare. So how do we do this particular review? So we started off by doing a scoping review. And originally, we were going to simply look at articles that examined governance of federated learning in healthcare. But that search returned a very small amount of articles, and we realized we needed to be broader within our search. So effectively, we expanded it to other terminology as well and other technologies. So we also examined studies investigating the governance of machine learning and the governance of federated data networks in healthcare. And these are related but distinct from federated learning. So through that process, we identified 39 studies which were included in the review. Then we had to proceed to the data analysis phase. So within the data analysis, what we did is for each of those 39 articles, we read them line by line to identify and extract information about the procedural, relational, and structural mechanisms. So each statement that spoke about a procedure, we would just drag and drop into procedures. Likewise, for structures, we would drag and drop. We didn't try to do any sort of classification, codification at that point. It was purely just grouping them into these high level themes. Then from there, what we did is we used open coding and we looked at all of those different quotes that were appearing within the procedural mechanisms, and we started to identify themes based on their similarity and differences. And then we again did that process, constantly comparing each quote to each other and each theme to each other to then make a more granular, refined list that would have some degree of utility in practice. Now, if you recall on the last slide, I said we had to expand the search to include federated data networks, machine learning, and federated learning. So we also, once we had the specific types of mechanisms that need to be included, we then mapped each of those mechanisms to the particular technology involved. So as I said, 39 papers were included in the review. 31 were on machine learning, 5 on federated data networks, 7 on governance of federated learning. Clearly, those numbers don't equate to 39, but that's because an article can actually look at multiple different types of technologies. So commonly federated learning papers actually spoke about some governance techniques for machine learning as well. What was concerning to us, though, was the nature of these papers. So effectively, when we looked at how these papers were actually conducted, we found that 27 of the 39 papers were conceptual in nature, meaning that they didn't use any data or evidence to real empirical evidence to support their claims. There were 12 empirical papers, but 6 of those empirical papers were simply case descriptions, again without data and evidence supporting. So we didn't have really a rich evidence base to draw from. So what that meant is that the insights and the conclusions that we reached weren't necessarily as operational in nature as we would like. They were more high level, but it still provided us with a useful stepping point. So effectively, through that analysis, we managed to distill this high-level framework for data governance for federated learning in healthcare. So overall, we identified 4 procedural mechanism themes, so data privacy, guidelines and agreements, model utility, and ongoing monitoring. We identified 4 relational mechanisms themes, so capability, ethics, involvement, and institutional support, and 3 structural mechanism themes, oversight bodies, roles, and the role of health consumers as a separate theme as well. Now you can see some of these items have an asterisk next to them, and that asterisk simply means that the theme or the sub-theme has not been explored in federated learning papers. It doesn't mean that it's not important, it's just it hasn't been recognized as being important in current publications. So we would have to critically think upon them when we do go about governing things in federated learning. So I'm now going to provide you with the analysis of each of these different mechanisms. There's going to be a lot of text on the screen. I'm not expecting anyone to memorize anything. It's just to give you an oversight as to the types of things that we found. So when it came to procedural mechanisms, we identified those 4 themes. So privacy, guidelines and agreements, initial model utility, and ongoing monitoring. You can see for the vast majority of these elements, they were identified as being important for every single technology we looked at: federated learning, machine learning, and federated data networks. What's important to note is some of those data share, even though data is not being shared, those data privacy elements that are thought of in traditional machine learning are still thought of in exactly the same way as when it comes to federated learning. The core difference here was that we saw that initial model evaluation and registration had not been discussed in the context of federated learning, but that doesn't mean that it is not important. So that was the procedural mechanisms. Another thing that was really interesting when it came to procedural mechanisms was sustainability. Sustainability seemed to come up a little bit more in the federated learning papers than the other papers, and it was really about practices to ensure the longevity of the model and also the relationships that were at play. Because in a federated learning environment, because the data is not being shared, you need to ensure that the partners are going to stay on board for a certain period of time to ensure longevity, because if a partner drops out, it has consequential implications for the ongoing learning that is taking place. Then we had our relational mechanisms. Now, relational mechanisms are normally actually relegated as being the soft mechanisms. However, we've actually been conducting interviews with a wide variety of stakeholders at the moment in terms of sort of figuring out how to operationalize these mechanisms. And time again across these interviews, the stakeholders are telling us that these are the most important things to consider, and these are the core challenges that they're actually facing. So, in other words, they can handle this, they can figure out what the procedural mechanisms are, they can figure out ways in which to enact them. But when it comes to dealing with the people involved and the tension between different stakeholder groups, that's where the challenges really seem to be stemming from. So in this, we saw capabilities were important, and this was really about capability development within each of the site nodes. So typically, when it comes to machine learning, traditional approaches to machine learning, the technical expertise really needs to be at that central site where all the data is being shared with and where all the learning takes place. But when it comes to federated learning, you need to have technical experts embedded within each of the site nodes to also engage in this learning process. That has financial implications, which then draws upon the need for institutional support. So the leadership has to be committed to it, to actually provision resources to support the vision. And there needs to be this culture around it that values trust, transparency, and accountability in data use. We saw similar considerations across federated learning, machine learning, and federated data networks when it came to things like ethics and consent. And consent still seems to be a core issue that is occurring across all of these technologies. It's how do you secure consent when you have thousands of records in play? And then involvement, it's about making sure that every single stakeholder group comes to the table to ensure that trust can be established. And then it comes to the structural mechanisms, and this is probably where we saw a little bit more variation occurring between federated learning, machine learning, and federated data networks. But this could also be to do with the granularity of the articles and the terminology that each of these particular articles used when they were forming each of these categories. But we saw that oversight bodies, roles, and the health consumers were important. When it came to the one core difference was when it came to federated learning, the role of the data steward seemed to be more important. And that term was less important when it came to machine learning. So in machine learning, the term data custodian was really used to ensure that the data was kept secure and confidential. But then when it came to federated learning, the notion of data steward seemed to emerge more prominently because there needed to be someone at the site who really understood this learning process and who could engage with the learning process within site nodes. The other thing I would like to highlight on this slide is this establishing and considering health consumers. Now, we know from a lot of health research that involving health consumers from the very start is of critical importance, and that's becoming more and more well recognized. A lot of our grant funding bodies are recognizing that as well now. When it comes to federated learning and machine learning, however, and the governance of it, what we're seeing is health consumers are sort of still being relegated to be a passive participant, i.e., they're viewed as something like a data subject, as opposed to someone who is actively involved in this process. So there needs to be critical reflections as to how do we involve consumers in a meaningful way and not relegate them to some sort of a terminology that implies a passiveness. So if I just go back to our model. So those findings, as I said earlier, are at a high level. But what it enables us to do is in that MRFF project that I was discussing earlier, it enables us to ask questions about the important things to consider when it comes to governance. So when we're governing federated learning in healthcare, what questions do we need to ask about data provisioning and control, data de-identification, data security? Simply in having this framework in place and asking the right questions will help us to identify how to best operationalize each of these particular areas. So the core conclusion from this research is, in contrast to the predominant view that federated learning is a solution to the governance constraints surrounding the sharing of sensitive health information, we identified that federated learning is still accompanied by governance challenges. Any tool or technology that does get implemented in healthcare will always have governance challenges attached. That doesn't mean we run away from that technology. It means that we actually think about what those governance challenges are and we put safeguards into place and robust and agile safeguards into place to ensure that we can actually use that technology in safe and appropriate ways. In this study, we identified the procedural, relational, and instructional mechanisms that healthcare organizations should enact when governing federated learning. But as I said as well, for the NINA project, the MRFF project that's ongoing at the moment, and for other projects that are ongoing in federated learning, this framework actually provides individuals with the opportunity to question what things they need to have in place to govern effectively. So overall, we provided a consolidated account that identifies and classifies governance mechanisms into theoretical, meaningful, and practically relevant categories. So that's the conclusion of the presentation. If you do have any questions, please feel free to reach out to me directly by email if you have any recommendations. I would love to know your thoughts.
Oh, Lois.
Fantastic presentation and really great work. Some of the areas that you flagged as not being addressed in federated learning in the literature, I think at least some groups have got some practical steps in place where they're actually using that. Is there opportunity to do a survey in specific areas and see what's being used in practice and how that compares across groups?
Yeah, that's a really important question, Lois. And I ended up getting rid of what our next step slides are for this work. But in terms of our next step slides, there's a few things we're doing to really learn from practice. one of which is to canvass where possible existing governance frameworks that do exist in this space. So that would be one approach. The second approach that we're actually using is more of a qualitative methodology. And in that qualitative methodology, we're interviewing a whole bunch of stakeholders to see what they're doing to address each of these areas. We haven't thought about a survey at this point, but I think once we actually start getting some cool things from those interviews, the next step could be a survey to really empirically assess and quantify the level in which all of these elements need to be enacted.
Yeah, great. Thanks.
Such.
Yeah, echo what Lois said, Rebekah. Great summary and great piece of work. I guess thinking about, I mean, trust has come up with the relational mechanisms, and you made the point that even though it's considered the softer components, they're probably in some ways the biggest barriers in implementation. I guess thinking about kind of relational mechanisms, what is has any of the literature really talked about the role of the Commonwealth government, for example, like at a government level, what role they play in kind of setting some policy-driven intervention that takes the balanced view and think about governance in general, specifically around kind of breaking down some of these barriers, or at least to help catalyze some meaningful progress.
Yeah, really interesting perspective there. And so it's as a side project to this, we're doing a research on what the public values when it comes to secondary use of health data. And when we look at public values, it's really about what the public believes the government should do to facilitate all of this to actually happen. One of those particular values is balanced interest, which is what you just mentioned there. So the question is then how can the government ensure that they're actually balancing the interests of the various stakeholder groups that are at play whilst managing the risks that are associated? So I'm not sure of a specific approach to it yet that is addressing it, but it is something that we've actually started to look at and explore, like what the government can do to facilitate this. It is very difficult when it comes to things like trust, because quite commonly things can be enacted federally, but if there is not a trusted relationship between the site node and the central node, breakdowns can still exist. So we need to have everyone at the table to sort of figure out what structures and policies can be put into place to facilitate that. I do know obviously that there has been work federally to sort of try to identify what standards and policies and practices can be put into place and enacted so that then there's sort of like safeguards in place. But yeah, that interpersonal relationships is where there seems to be some sticking points.
Thanks, Rebekah. Thank you.
The question from Jacqueline is around the having, I guess, the working with Ashbreak and have in place like approved standard and procedure or guideline that would facilitate the procedural pathways.
Yeah, that's a really good point. When it comes to the ethical considerations associated with federated learning, there is questions as to where the ethics should actually sit, if it should be at the site nodes or it should be at the central nodes, for instance. But when it comes to HREC approval, it would definitely benefit from standardized templates to be put into place so that all federated learning projects have a standard that they can actually use. Dom, Lois, many people on the call at the moment are already engaged in a project on that to really identify how can we have standard templates in place to really facilitate ethics agreements, contractual agreements, so that we're not trying to reinvent the wheel every time we're applying for these things.
Thanks, Beck. And Ilan?
Hi, Beck. Amazing presentation. I've read the paper in detail, but it's so excellent to have the verbal walkthrough. Beck, I wondered where, and maybe I missed it in the presentation, but I wondered where exploration of safe questions for federated learning comes into the governance framework, particularly when most of the data points are likely to be a secondary use of health data without individually informed consent, as you alluded to, the challenge of so many records. Therefore, research really needs to meet a public interest test in order to go ahead. I guess where my mind goes is that some of these models, they have immense commercial value. How have you done any exploration of what questions are appropriate for this methodology and what potentially falls out of scope? Just because we can do something doesn't mean that we should do something.
That is a fantastic question, fantastic point. And you are 100% right that a lot of the times these models can be used for commercial interests, not necessarily for public interests. So there is a challenge. And that's why it was so important to us that when we explain what data governance is, that we said it's also the use of data. It's about asking appropriate questions. In an ideal world, all the procedural, the relational and structural mechanisms would be feeding into what are safe and appropriate questions to ask. So when it comes to the procedural mechanisms, we have the guidelines in place that this is sort of ticking our boxes as to what a safe question is or a fair principle is. Then when it comes to the relational mechanisms, in that really meaningful engagement with stakeholders should be taking place to healthcare consumers should be taking place to figure out what are ethically appropriate questions to ask. And that's what our public values project is doing. That's what our social license project is doing, is really engaging with the consumer. And then finally, in that structural mechanisms, it's about how can we create structural mechanisms that ongoingly include the consumer in these decisions. So they're not just included at the start, but they're included throughout the entire life cycle. And for a large extent, that's not being done. And what I'm seeing in literature, it's not being meaningfully done at the moment. As I said, like the literature is still using the term data subject and those sorts of things, as opposed to really truly reflecting on what it means to the health consumer. So I think that's where the challenge is. It's across everything. It's the whole goal of appropriate and good governance is that it's embedded across all stages.